Good evening, everyone, and welcome to our first New York Bariatric Group and NYBG Plastic Surgery live Q&A session with Dr. Nick Sekhar and Dr. Shuja Shafqat. Thank you, everybody, for joining us this evening, and we're going to go ahead and get started. So I'm going to turn things over to Dr. Shafqat.
Good evening, everyone. Well, thanks a lot for joining us. A little bit of a different format for us, but we thought it would be nice to have both Dr. Sekhar representing the bariatrics portion of our practice and myself representing the plastic surgery portion of our practice to kind of go over how things work together. And basically, we'll jump right into it. So I actually came up with a list of questions for you, Dr. Sekhar, things that I hear commonly or questions I hear commonly from patients. So the first one I wanted to ask you is, there's a lot of people who maybe come for surgery, but they're, not optimized. They have a high BMI, and I always recommend looking at bariatric surgery, if they're coming in for a body contouring type of situation. A lot of people are very hesitant to kind of undergo that process. So talk a little bit about, the safety of bariatric surgery and how you navigate patients through the process from when you first meet them all the way through to surgery.
Thanks, Shuja. I'm happy to be a part of this with you. I'm happy to have you join our team. And I know our patients in New Jersey and Staten Island are very lucky to have you aboard. So I'm sure you'll be a great asset to our patients and our group. So thank you for giving me the opportunity to answer your questions, which I'm sure are also very common questions that patients are thinking of as well. And we'll have an opportunity later in this format to pose some of the questions that patients commonly ask me, because that's a universal question. What do I do about extra skin? I'm not going to give you any spoilers, but we'll chat about it later, what the commonly asked questions are. But that's a real good starting off point, because we're only treating about 1% of the patients who qualify for bariatric surgery in this country. And a lot of that stems from stigma and also from unnecessary fear about the surgery. The surgery is actually the safest elective surgery that is currently performed in the country. And I've been doing this over 20 years. When I started, it certainly wasn't. We had nearly a 1% mortality rate with the old open bypass surgery. And as a nation, this has dropped to less than 1/10 of 1%. And in our group, it's actually approaching nearly zero. We've done over 7,000 cases, and I personally have done close to 3,000 cases without a single death related to the surgery. So in my hands or any of the experienced hands at NYBG, your risk of a complication, let alone death, is extremely low. I've only had one leak after surgery, which was treated and the patient recovered, and less than a handful of bleeds that were treated non-operatively. So we have the skill and the experience to make this elective surgery, a choice that a patient is making to come and see us for care, an extremely safe experience. So I would urge any patient to really consider the experience of their surgeon and the ongoing experience of their surgeon, because that is inextricably linked to the rate of complication. So if a patient is seeing one of our surgeons in NYBG, they know that they're in safe hands, because they're going to be seeing someone like myself who has a long breadth of experience, length of experience, and continued facility in the surgery. So rest assured, anyone who's watching or anyone who's considering that this is safe and effective surgery. It's certainly much safer than the alternative, which is going down a sure pathway to early mortality and chronic illness and disease. The rate of death from non-surgical weight loss is still around 9%. So even 20 years ago, when we were comparing open gastric bypass surgery with a 1% rate to non-surgical weight loss, which had a 9% death rate in 2 years because patients were dying from preventable illness like complications of diabetes, which include heart disease, renal failure, strokes, all these big killers that would get a patient without fail within a few years of going down this unsafe pathway. So now that we have a safe alternative, we want to increase that access to care because there's a huge need for it. There's an underserved population who are stigmatized and are told by friends, family, even their own doctors that they can do it on their own. They just haven't been trying enough. It's a lack of motivation. So we need to erase the stigma and the fear that still persists around bariatric surgery.
I think you brought up two really interesting points, is that how far we've come in safety of surgery and safety of anesthesia to do these procedures. And then the other thing that you brought up, which is interesting, is looking at the experience of your surgeon. And as the world of surgery and even medicine grows, people's niches in their specific field, even within their specialty, are growing smaller and smaller. So those are two really nice points. We hear a lot of different procedures: lap band, sleeve, bypass, duodenal switch. How do you help patients decide which is the best procedure for them?
Yes, a lot of patients come in with preconceived notions about what the best surgery is for them. And a lot of that comes from friends and family who may have experience with one surgery, or a surgeon who may have been in their local area before we came to the region, who was only doing one procedure. And that's really what they want to get. So it's a dialogue. I want to steer you to I want to steer the patient to the best option for them, considering their past medical history, their desire for invasiveness of the surgery or non-invasiveness of the surgery. So we have a dialogue. It's not a paternal relationship where I force a patient to go for one surgery or another. But that being said, most patients opt for the sleeve gastrectomy. In my experience, and I've seen the evolution of bariatric surgery from open bariatric surgery to laparoscopic surgery through different procedures like the lap band and the lap sleeve and the gastric bypass. So despite my youthful appearance, I've been doing this for a long time. But what I found to be the most effective surgery and the safest option is the sleeve gastrectomy. The surgery itself takes me on average about 20 minutes to do. Patient is under anesthesia for less than 45 minutes. So they spring back up. The next morning when I see a patient, they're ready to go. They're packed up. They're ready to leave the hospital. We've even started doing the surgery as an ambulatory procedure, which was unheard of when I first started doing this. So we've come a long way. The safety and efficacy of the sleeve gastrectomy are really unparalleled. So if a patient qualifies for it, which is at a lower weight than you would expect, a patient will qualify for the surgery with a BMI of 35 and a comorbidity, which a comorbidity includes diabetes or high blood pressure, even sleep apnea, which most patients are unaware that they have. They may be the spouse that their mate wants to go and sleep in a different bedroom at night, and that may be an indication that they do have sleep apnea. Snoring is a really good indicator, and that's enough to help qualify many of our patients who may have thought themselves to be borderline for the surgery will actually get approved for the surgery. So don't discount, even if you're feeling that your weight is too low for bariatric surgery. We can see you and find a way to help you, because that's really what we need to do. The classifications are kind of held artificially low, in many cases, and we see a lot of benefit for patients even at lower BMIs.
Great. So you mentioned how quickly patients kind of bounce back in the evolution from these open surgeries, which were plagued with complications, all the way up to laparoscopic and robotic. So how much time do people need to take off, when they have these procedures, and does it depend on the procedures that they have?
It really depends on the length of time under anesthesia. So if you have an experienced surgeon who's not going to take hours, 3 or 4 hours to do the surgery, my patients, even for a revision surgery like a gastric bypass, are under anesthesia for around an hour. That seems to be the cutoff where you can leave the same day or early the next morning, or you end up staying a night or two in the hospital. So my patients will generally 99% of the time go home the next day, or even now we have the opportunity to send patients home the same day. And then I've had patients who've gone back to working from home even the same day, the next day from the surgery. Now, I always urge patients to take the time for themselves for at least a week, 1 week, to recover and focus on their diet and exercise, because it's difficult to balance learning to live with the new surgery and going back to a full busy schedule. You really, even though they're going to miss you at work and you're probably the best person there and the office is going to fall apart if you're gone, resist the entreaties to go back to work immediately and take a week to really learn how to use your tool. That's what it comes down to. It's not that you're going to feel a lot of pain or low energy and you need to take the time off or weeks off. But I would urge any patient, even though they may feel perfectly fine, take a week, learn how to get into an exercise rhythm and into a regimen with their diet. And then they can go back focused on their important tasks. For somebody who does a lot of physical labor or heavy lifting or a very physically demanding job like a firefighter, I would say take 3 to 4 weeks, because just to decrease the risk of an injury, work-related injury. But it's a very small subset of the population of our patient population who needs to take more than a week or 2 off of work.
Then my last question for you is, certainly some patients come with weight regain after these procedures. How do you address that with patients who've had either a gastric sleeve or a gastric bypass? What is your discussion with them, and what options do you typically give them?
Yes, so we have a multifaceted approach to weight regain after surgery. The first thing I discuss with the patient is let go of the guilt. Not every procedure is designed for every patient. So even though the sleeve works for about 90% of my patients, there's still about 10% of patients who will regain weight, despite following the protocol with diet and exercise. And for whatever reason, that patient's physiology requires the additional weight loss that comes with malabsorption. So for that patient who has started to regain weight with a sleeve gastrectomy, I offer the bypass. And what that does, because often the patient who comes to me from another surgeon may have an improperly done surgery with a residual part of their fundus, which is at the top of the stomach, left behind. And they also have reflux in addition to the weight regain. And it's not their fault. Stomachs don't stretch out. It was normally the case of a surgery that was done improperly the first time and too much of the stomach was left behind. But for my patients who have gotten a great surgery, there may be that need for the additional help that comes with the malabsorption. So I offer those patients the bypass, which I can typically do in 45 minutes to an hour. Most of the surgery has already been done with the sleeve. And then I staple across the sleeve, make a small pouch, and add the loop of malabsorption and reconnect it distally. So you end up with the smaller pouch, about a quarter of the size of the sleeve, plus you're only absorbing about half of your calories. That comes with the caveat of you do have to take care to avoid malnutrition of vitamins and iron. But that's why it's important to commit to follow up. And that's another thing with patients who regain weight. I rarely see a patient who regains weight who has been following up regularly. So the key is also to follow up regularly. We commit to, and I know this is also another common question. We want to see our patients not every 6 months or every 3 months. We want to see you 1 week after and then every month after the surgery. And that's critical to the success. And I have endoscopic revision options for patients who have regained weight after a bypass, which is a difficult problem to fix, but I use an incisionless approach, which means that I don't need to make any additional cuts. I go in right through the mouth and I use an endoscopic suturing device to tighten up the pouch and the opening. So we can help you without giving you another scar. Even if you had an open bypass 20 years ago, we can do an endoscopic revision through your mouth. So I hope that answers your frequently asked questions about bariatric surgery.
No, that's great. And I'm just, I've been with the practice for a short while now. I'm very impressed with the skill level of all the bariatric surgeons in the practice. I mean, it's vastly different from, years ago when I did these cases in training. The level of, skill, attention to detail, is very, very impressive, across the board. So you all built a great model here, with the experience, and I'm very, very impressed so far.
Yeah, thank you. And I'm sure that you have joined the best team in the business, in the region. And but just based on our brief interaction, I'm sure you'll be able to help a lot of our patients.
Yeah, absolutely. I'm hoping to.
So now I'm going to put you in the spotlight. What I get asked by patients a lot on the first visit is, what do I do with the extra skin?
Yep. So, my kind of intro to this is plastic surgery is a very diverse field. And there's a lot of, like I mentioned, niche areas of plastic surgery that people kind of focus on. There's cosmetics, there's reconstructive. So, when I think of plastic surgery, and a lot of what we do is returning something back to normal. Whether it's a traumatic issue, whether it's a congenital issue, you were born with it, cancer, anything like that. We're trying to make things back normal. You can see from some of your patients after they've lost the weight and been stable is that having that extra hanging skin is definitely not normal. And it can cause a lot of problems, rashes and back pain and, quality of life issues. And so, with the extra skin, we talk about things like post-bariatric body contouring, or I almost think of it as a reconstructive procedure, because we're trying to return people back to kind of a normal standpoint. And there's tons of different surgeries that people have done and we can do to remove the extra skin, to give people the quality of life, improve their function. Any medical issues they're having from that extra skin can be alleviated. Return them back to normal work. I mean, it always makes me a little sad that, people put in all this work to get bariatric surgery and lose the weight and go through the follow-up and all of that, and they still have a hard time getting back to the life that they want to because they have the extra skin. They can't even work out the way they want to because of all that extra skin, and it's a little sad. And that's why I hope to bring more of these procedures around so that, people can realize that, yes, I can get the life I wanted to. This is what I kind of envisioned when I went on this pathway of bariatric surgery, is getting back to normal, getting my life back to normal, improving my quality of life, from every standpoint. So there's lots of different types of surgeries that we do. Those have gone through an evolution process, much like, the bariatric procedures have. But we talk about addressing the trunk and removing skin from the trunk, like lower body lifts or abdominoplasties. We talk about removing skin from the thighs, removing skin from the arms, breast lifts and all those types of things, or breast reductions. So there's a variety of different types of procedures. They also go from, different flavors from, if you don't have a lot of extra skin, there's more minimal things that you can do, smaller incisions, using different technologies to help tighten the skin versus, kind of the more traditional approach to remove the extra skin just by simply cutting it out.
Yeah, that's a good summary of the frequently asked questions about plastic surgery. But the next question that I always get is it covered by insurance?
So that is always the great question. It's insurance is really looking at things that are medically beneficial, as similar to bariatric surgery. There's a proven benefit to bariatric surgery in terms of reducing your comorbidities, improving diabetes, improving high blood pressure, improving, mortality. Anything that we can show that shows that the patient will get a medical benefit from removing the extra skin, usually insurance will cover. Things like rashes. People will see their primary doctor, they'll see a dermatologist because they get frequent rashes or infections from the skin folds using antifungal powders. And that can be either in the skin folds underneath the stomach skin, it can be in the armpit from excess arm skin, in the groin from extra thigh skin. People want to see that they have some sort of functional issue in terms of either back pain, especially from the extra skin of the abdomen. A lot of people will get lower back pain from hanging, carrying around that extra weight through the hanging skin. So anything we can do to show that you will have a medical benefit to removing that extra skin, insurance will typically cover. Now, there are some things that we can do to improve the result from surgery from a cosmetic standpoint that typically insurance does not cover, like liposuction and things like that. But I think, like you mentioned, having the team approach and the experience. So, our team does this all day, every day. Our team basically does insurance authorizations for these types of cases all the time. So, you have the team with the experience to really get you there that most places may not have.
Yeah, that's and that's really why patients choose our group and our plastic surgery group, is that depth and breadth of the experience that extends across the entire team, and everyone is dedicated to the patient's success and is personally invested in the patient's success. So the other question I get from patients is it painful? And what does the post-operative period look like for this surgery?
Yeah, that's a great question, because a lot of people have already gone through the bariatric surgery process. And as you know, the recovery from that is great. There's small incisions, whether you do it laparoscopically, robotically, whatever, minimal pain. These surgeries are very different. And typically they're one of the biggest surgeries that these patients are going to have. To really remove that extra skin does require, big incisions and big scars. And we have ways of making those scars really nice, from, the way we do the surgery, the way we suture, all that kind of stuff. One of my passions is trying to reduce opioid consumption. So we hear that a lot in surgery. And so we typically do what we call a multimodal pain approach to these surgeries. So we use a lot of Exparel, not to use a brand name, but long-acting local anesthetics that will give you pain relief over a period of days rather than hours. We use a lot of medications to address certain types of pain that are not narcotics. A lot of, the old way was just, give patients narcotics to treat the pain, but we know that there's different types of pain. We know that there is neuropathic pain. We know there's muscle spasm type pain. We know that there's a lot of those things. So our approach is to use, a lot of extra strength Tylenol, whether IV or oral, using nerve blocking agents and using muscle relaxants to really address all those types of pain so we can limit or even eliminate how much narcotic people use. And obviously that has a lot of impact from just the side effects of narcotics to, more serious complications that people can get from using narcotics.
Yeah, that's a great answer. And it's clear that you have a lot of experience and passion for what you do. So another question from patients is, how do I qualify for the surgery? What criteria do I have to meet to qualify for it?
That's a great question. So, obviously we talked about insurance criteria. What we want to look for is that, while some may not consider these truly cosmetic procedures, they are elective procedures. And so we want to make sure that you are in the best shape to do the best from these surgeries with as little hiccups down the road as possible. So really, number one, we want to make sure that your weight is stable, that you've recovered from your bariatric surgery, your weight has been stable for a period of time, your nutrition is good, your vitamins levels are good, especially for the malabsorptive procedures, your protein levels are good, really giving people the building blocks to help heal. We also want to make sure that anything that we know that can impact your ability to heal to whatever way that we can address. So, a lot of patients, will have a lot of benefit or resolution in their glucose control or their diabetes with just the bariatric surgery. But we know that diabetes has a significant impact on how people heal and how people do with all types of plastic surgery. So we want to make sure that people's hemoglobin A1Cs are at a reasonable level. We want to make sure, again, that your BMI is at a good level. We're looking for patients usually for BMI less than 30, because we know in the spectrum of plastic surgery and in all surgery, we know that as BMI level goes up, the risk of complications from surgery goes up. Making sure your blood pressure is well controlled. Smoking is a big one. We know that smoking can impact healing in so many different ways, even just nicotine products in general, whether it's gum, patches, vaping, all that kind of stuff, we know that can have a significant impact on how people heal. And because they are large incisions, we want to make sure that people can heal as well as possible. So, we have insurance criteria and then we have our own criteria. And so we just want to optimize that. We work with your primary doctor. We work with any specialist you have, whether it's an endocrinologist or a rheumatologist or whoever, to try to optimize all of the issues that we may see that may impact how you do from surgery, and try to make those, as optimal as we can so that you can get through as easily as possible.
Another common question is, if you are operating on the extra skin on the belly, can you do other things at the same time?
Good question. And it depends. A lot of patients after these surgeries, as you've probably noticed, they have extra skin in multiple areas. And we try to do the most we can under anesthesia that's reasonable, but we know that, as you mentioned, people's recovery is definitely impacted by the time under anesthesia, longer surgery, longer recovery time, and sometimes more complications. So, you'll see other people do these big extreme makeover surgeries, and we try not to do that just because, again, we want to make sure people are safe, people recover well. So doing all of these procedures combined into one is really unsafe at the end of the day. We try to do as much as we can in one go. But again, when we're starting to talk about doing the belly and the breasts at the same time, again, it depends. If we're doing a full lower body lift, it's very hard to do breasts at the same time. If you're just having an abdominoplasty, then yeah, you could. It's again just about the time under anesthesia that it's going to take. So we try to, again, make sure our patients are safe. We want our patients to do well. And so, we try to do the most we can, but again, within the realm of safety. And that's what it comes down to is safety.
Thank you for that really excellent summary of the frequently asked questions about bariatric and plastic surgery and how they really complement each other. And I really applaud your dedication and obvious passion for what you do. And so why don't we turn over to some questions from the audience? We've been getting them as we've been doing our discussion. Do you want to start?
Yeah, sure. So, one question that came through for me is, again, is skin surgery covered by insurance? So, we talked about that. We want to see, insurances have very specific criteria. So again, they want your BMI to be, usually less than 30, or at least you've attained your goal weight for at least 3 months, especially after bariatric surgery. They want to look for, especially for the belly, which is the area that we really focus on, especially with insurance, is does that apron of skin hang past a certain point? And it's usually the pubic bone or kind of covering that upper thigh crease. Rashes, especially documentation of rashes. So if any patients are considering getting this done, if you get rashes, take pictures of it. Pictures are worth 1,000 words. We used to just send letters to the insurance company. Now they're all looking for pictures. So anytime you see us, we take pictures of everything. So if you have pictures of rashes, if you have pictures of wounds, anything like that, send them to us or bring them in. And letters are always very helpful to get some of these procedures covered by insurance. Whether you have a dermatologist who's treated these infections, whether you have a PCP who's treated them, whether you have a pain doctor or a chiropractor who's treated your back pain from some of these things, and that can be excess skin of the belly, but also larger breasts. We see that in breast reduction patients. Any of that documentation is helpful.
I'll turn over to one of my questions. Thank you for that summary of the insurance-related issues, which are a very common concern for patients. One of the participants asked, if you have a lot of acid reflux, is it true that you can only get the bypass and not the sleeve? I can say that it depends. So that's why if you've had a history of reflux, we urge you to have an endoscopy performed, which we can do very safely in one of our centers with an extremely experienced anesthesiologist who's done well over 10,000 of these procedures. So if you go to a hospital or another GI center, often our patients will be intubated and put under general anesthesia for the endoscopy. We have never done that in my experience in our offices because our anesthesiologists have a lot of experience. We do a very safe, efficient procedure that does not require a lot of anesthesia. And we're checking to answer that question, to see whether your history of reflux has caused premalignant changes. So we look at the distal esophagus, the part where the esophagus meets up with the stomach. And that's where we see the long-term effects of reflux. So if you had precancerous changes there, we would recommend doing the bypass because that's something that can resolve with the complete exclusion of the acid-producing stomach from the esophagus. But for mild cases of reflux, I've actually seen reflux improve after the sleeve. It may get worse for a few weeks after the procedure because now there's a small, tight stomach versus the large capacity stomach. But that tends to resolve after the weight loss. And the way I do the sleeve, I was trained as a foregut surgeon as well as a bariatric surgeon. So I had a lot of experience with esophageal surgery and surgery for reflux. So I pay special attention to that lower esophageal sphincter, which is the built-in valve that prevents reflux. So I make sure that the stomach is below that, and that if there is a hernia, we fix it at the time of the surgery. So it's not a preclusion to go for the sleeve if you do have a history of reflux.
All right. There's one more question for me, and somebody asked, what do you mean by a full lower body plastic surgery? So that's a great question. So whenever, like I mentioned, whenever we do these surgeries for body contouring, there are kind of minimal invasive approaches and more maximal surgeries, and it really depends on what the patient needs. So, the best example is talking about like the arms. People will see the scar for an arm lift, and some patients who have a lot of excess skin need that scar to remove the skin. Some patients who maybe have very minimal excess skin and more fat in the arm can do well with liposuction and maybe a smaller scar just in the armpit. When we talk about the waist or the belly, these patients have extra skin kind of in all dimensions after weight loss, both the vertical, horizontal. So it's very different from a traditional, just a tummy tuck where people have just the extra skin in the front. These people have extra skin all the way around. They noted that the buttocks have fallen and the buttocks have deflated as well. And so when we address that, a lot of people address that with what we call a fleur de lis, or the upside down T tummy tuck, where you have the lower horizontal scar, but also an up and down scar in the middle. What our approach to that is to do what we call a lower body lift, which means it's a 360-degree removal of skin from the back, the hips, and the front. And so it combines the removal of skin from the back with the traditional tummy tuck because it really helps tighten the skin in all dimensions and usually avoids giving people that up and down scar. And so we try to hide those scars as much as possible. So avoiding giving people an up and down scar is beneficial a lot of the time.
Yeah, that's great, because when I was trained early in my career, we did that a procedure you're describing, and it often left an awful scar and a junction between the vertical and horizontal incision that would open or take a long time to heal. So you really need to be an artist to do what you do. So I appreciate you for doing it. One question that came up for me was, and a question that I often get, and it's, I gained back weight after a sleeve. Can I have another sleeve? My approach for patients who've gained weight after a sleeve is conversion to the bypass, because I have experience going back many years with doing the bypass. So I have a lot of experience doing the bypass, and I can do it very safely. So it shouldn't have the fear factor that may have driven you to the sleeve in the first place. The way I do the gastric bypass, the laparoscopic gastric bypass, as a revision for the sleeve, my average operative time is usually between 45 minutes to 60 minutes because most of the surgery has already been done. All it takes is for me to staple across the sleeve. I make the pouch, I bring up a loop of intestine, I hook it together, I disconnect it, and I hook it back together. So that shouldn't take an experienced surgeon longer than an hour. And that's why it shouldn't have the fear factor that may have driven you to the sleeve in the first place. It will relieve the reflux. I've had patients wake up in the recovery room and tears streaming down their face because this is the first time that they haven't had reflux in years since they had the sleeve. And plus, they don't feel hungry, the weight comes off. Very small percentage of patients will have some vitamin or iron deficiency issues that may require infusion or an intravenous infusion occasionally. But it's a small price to pay for getting their lives back, being off of their diabetes medicine, being off of their blood pressure medicine, and just feeling like themselves again because they're having excellent weight loss again.
Awesome.
So I'll turn it back to you.
Yeah. Another question for me is, if insurance doesn't cover plastic surgery, what is the cost of some of the procedures? Great question. Very much dependent on what we decide to do. It's a little hard to give ballpark estimates just because things are so variable depending on what you want to do and what you need. And the best thing is to come in and discuss that with us, and we discuss what's the best approach and what seems to be reasonable. And a lot of it has to do with time. So, especially from a hospital anesthesia standpoint, they look at time under anesthesia. And so that will impact kind of the overall cost, but it's highly variable depending on what you want to do. But certainly, the best thing is to come in, talk with us. We can kind of go over the different options that we have available. And the best thing we have now is financing for these surgeries. It's really, really good. We work with 2 companies that do a lot of financing for our surgeries. They give us good deals because we do a lot of business with them. And so it really, really helps, get some of that stuff covered for the stuff that comes out of pocket. So, come see us, make an appointment. We can kind of go over all that stuff. We can give you, ballpark estimates in the office and we go from there. But we always work with you, and we know that, you know, people have certain preferences, certain limitations, and we work with you, and that's the benefit of working with our group.
Yeah, thanks for that great answer. The other question that I see asked by one of our participants is a question about taking capsules after the sleeve. The capsule is fine anytime after the sleeve. You are not restricted on taking capsules after the sleeve gastrectomy. And I am back in New York, and Connecticut was another question, if I was back in New York. And I will answer another question. One question was, if you have kidney stones, can you do a gastric bypass? No problem with that. There is a potential for more dehydration after any bariatric surgery. So you just have to have a low threshold for seeking IV fluid. If you are not getting in enough IV fluid, that can certainly help lower the chances of developing a painful kidney stone. And stay in touch with us and your urologist, because we don't want to interpret something as a kidney stone and have it really be another issue. So the best thing is to stay in communication with us. We're here 24/7 to answer your questions. One of us is always on call to answer your questions after the surgery.
I just have to say, I'm very impressed with the skill level of all of you. Obviously, like you mentioned, but you all have a passion for this. Having the experience really counts, and being able to say that you've done so many surgeries with this complication rate is amazing to me. And how far these procedures have come just in a few years from when I did them in training is really incredible, and owes a lot to the group and how you all have kind of pushed the limits within safety, to get these procedures done in the safest possible manner.
Yeah, and I'm grateful for the opportunity to do what I love every day, which is taking care of our patients, doing the surgeries, seeing our patients' success month after month. I always tell patients, don't celebrate at home. I want you to share your success with us every month. So it's truly a blessing, and to get to do what I do every day.
Yeah, and I think, again, the benefit of this group is you have all the resources available to you, from bariatrics to nutrition to medical weight loss to, cardiology and pulmonary and, access to endoscopies and non-invasive surgery, minimally invasive surgery. I mean, you really have the spectrum of everything kind of under one roof. And, it's rare to see that, and, unique to practice. And I think it's one of the biggest benefits of being part of our practice is you just have an experience level that you don't necessarily get in other places.
Yeah, I totally agree with you. We have the every aspect of experience to offer, even including the one-day workup. We're really the first and the only group to pioneer the one-day workup, where patients can come in and not take 6 or 7 days off of work, come in and see the psychologist, the nutritionist, the cardiologist, the pulmonary doctor, get an endoscopy all in one day. So we really pioneered that concept, and it's reduced the wait time for surgery. When I started, it was routinely 6 months. And now recently I saw a patient and got him to surgery through the work of my incredible team supporting me, to surgery in less than a month from the initial visit. So that's really an accomplishment. You've taken a big step to even consider bariatric surgery. You've overcome the fear factor, the stigma. Now we're going to make it easy and streamlined process for you.
Great.
Thank you so much to our wonderful NYBG team. Thank you, Dr. Sekhar. Thank you, Dr. Shafqat. Thank you, everybody, for joining us this evening. And I'm going to close this out. So thank you all.
Good night.
Thanks, Megan. Thanks,
Take care.
Shuja. Thanks
Thank
to the
you.
audience.
Yes, thank you all for joining us.
Take
Have a
care.
good night.